Good afternoon. You're watching AB Live, a news chat show in which we discuss topics ranging from news, business, politics, and so much more. Well, there's only one topic in everyone's mind right now, and that is the new coronavirus. And on today's episode, we will be discussing healthcare and nursing in the time of COVID-19. Joining us remotely from her residences is Dr. Suzanne Robertson. Thank you so much for joining us, Dr. Suzanne.
Thank you for having me, Shilpi.
Right. So, Dr. Suzanne, I'm just going to start with your introduction. Can you tell us a little more about yourself and what you do?
Okay, my pleasure. So I have an undergraduate in nursing and I have graduate education, advanced specialisation in critical care and in particular cardiothoracic ICU. I'm currently working as a professor at the University of Wollongong, Dubai, where I'm overseeing the programs for health and health science.
All right, I'm sure this must be a very, very busy time for you. So let me just get straight into it. Let's start with what exactly is COVID-19 and what exactly makes it worse than a common flu, A, and secondly, the other coronaviruses that we've seen in the past.
So this is a very good question. And as you said, Shilpi, this is something that everybody's asking. And so as we know, coronavirus is a virus, and this is something that we've never seen before. It's new, and as a consequence, as a global community, we're racing to try and understand it better. And each day, as we share our information, we're learning more and more about it. But unlike influenza, which is an epidemic that we experience every year, we have a vaccine and we have treatments. And so corona is something that we're totally unaware of as far as last year, December, and then we are being faced with it and we're having to learn how to treat it. At this point in time, there's no effective treatment, and we're rapidly trying to identify a vaccine and the best way to manage it.
Right, so in terms of vaccine, how far have we reached in terms of a vaccine or an antidote for the virus today?
So the work is ongoing, Shilpi, all over the world. This is a wonderful time where you see the communities of health all over the world come together under the auspices of organisations such as the World Health Organization, the Centre for Disease Control, the John Hopkins Center for Epidemiology and Public Health, Global Public Health, all working tirelessly. Also, the Bill and Melinda Gates Foundation, actively working to identify a vaccine. But as you can appreciate, these things take time. And so when you've got a virus that has an exponential growth rate, and what I mean by that is that it doubles every day, literally, we are on our back foot because we have no treatment for it.
Right, so now since you're saying there is no treatment, I think this is one question that a lot of our viewers also have. So what exactly is being done with the patients that have been diagnosed with the coronavirus? So, all right, they go to the hospital, they're admitted there, then what? What exactly happens there if there is no treatment?
So you must...
Hello? Dr. Suzanne?
Can you hear me?
Sorry, now I can hear you. Can you just repeat your answer, please?
So essentially, as you raise a very good question, the intention of going to hospitals is that to manage the symptoms and to minimise those symptoms getting worse. And to prevent any further problems arising from the pneumonia that typically arises from the virus, and trying to manage that accordingly. As you can appreciate, pneumonia has a range of presentations from mild to severe. Severe being the examples where patients need to be intubated in order to be able to support their respiratory, their breathing and their function throughout that experience.
Right, so when you're talking about medication and treatment, as of today, the 31st of March, who would you say, or which treatment and medication would you say is a front runner?
So again, Shilpi, it is management of symptoms. So there is no treatment for corona. So it's the management of the symptoms that actually arise from the virus. so there are a lot of novel treatments being suggested, such as, and you can read them in the news. And I really encourage people during such times such as this to identify reliable sources of information. And I can share those with you, where you can share those with your listeners at the end of this session. I would encourage people to stay away from social media because there's so much fake news and fake information that can only alarm people. And so it's so important during times such as this that you actually get reliable information that you can depend on.
Right, so I'm just going to take in a few questions again, just to remind our viewers. It's not just me that will be asking questions today. We're also taking questions from the public, from the viewers who are watching us right now.
Sure.
And we've already got a few people asking us questions. So there's Deepak, who's asked two questions. The first question he's asking is, one of the major concerns I have is the vaccination for my son. I received notification from DHA cancelling my appointment. So visiting hospitals are risky. So how else can I get vaccinated? That is one of the questions he has.
Okay. So as mentioned, there is no vaccination for COVID-19 at this point in time.
Okay.
And so going to a hospital thinking that you're going to get a vaccination for COVID-19 is not correct. Maybe the suggestion that your viewer is thinking about is a vaccination for influenza, but that is not a vaccination for COVID-19.
Right, but as of now, are hospitals giving vaccinations for hepatitis, influenza, etc. at all, or has that been stopped completely?
So a good question. A lot of the health services and health systems in the region are having to reduce and redirect their services to critical care and emergency areas.
Right.
But vaccination is a critical requirement of a community, and so it helps to support the community's health.
Right.
So I would be surprised if vaccinations are being stopped by the primary health care centres. I haven't received that information. So I would just encourage the listener just to call their hospital and ask their advice as to how best to proceed next.
Right. So basically, from what you're saying, facilities and services have been reduced, but they haven't been stopped. He's got another question, which is, it is repeatedly said that this is not deadly but fast spreading. Isn't it enough to isolate and take rest then? I think this is again one of the questions that a lot of people have about the severity and the gravity of the virus today. How serious is it? So if you have a symptom, is it really important for you to go to the hospital, or should you just stay at home, self-isolate, and just recover? Because, well, even the hospitals don't have a treatment right now, do they?
So another good question. So transparency of symptoms and respect for your fellow human beings are essential qualities and behaviours that we need to get in order for us to be able to get ahead of this crisis.
Right.
So the moment you feel that you are developing a flu-like symptom, this can include a dry cough, muscle aches and pains, teary eyes, itchy eyes. You need to self-isolate.
Right.
So, and if you are living with people, you need to advise them that this is happening to you, and then you can commence quarantining and escalate precautions within your community. Now, this doesn't mean just because you've got these symptoms that you've got COVID, but the most important strategy that has been shown globally to have a positive impact on reducing the spread of this disease or the virus is social isolation.
Right.
And the hand hygiene and respect and transparency in your symptoms.
Right. Obviously, social distancing, social isolation, all of these points that is being reiterated, is being said by officials as well. Great.
Critical. So if over that period where you think, well, maybe you're uncertain and you're not quite sure that this could be happening to you, which is a very scary thing to think about, and you do the quarantining and you start looking after those who are with you to minimise potential spread, if you're doing that at home and then over 48 hours your symptoms appear to be getting worse, you then need to call your local doctor or your local hospital and seek their advice.
Right. So, doctor, is there a timeline for coronavirus as of today? Do you foresee, of course, we're talking about flattening the curve, but how flat is the curve today? And where do all of the health officials and the medical professionals see it completely getting flattened? And what exactly, essentially, is the timeline of this?
So the government, the UAE government has been incredibly proactive, and that has proven to be really valuable for the community of the UAE.
Right.
So countries across the world where they weren't proactive in instituting the very simple strategies such as social isolation, hand hygiene, educating the population about what it is that they can do to minimize the spread of the disease, are really struggling now. So the fact that the UAE government has implemented and utilized all forms of media where you can, every time you make a phone call, they advise you, or they get alerts and then they have the shutdown from particular times. These are really, really important strategies to try and get ahead of the virus.
For sure, but as of now, we don't really know which month or around which time it is going to perhaps end, right?
So we learnt from Italy and China that if you're able to implement these strategies and you implement them effectively, and that means 100%. People, the community are compliant and they're paying attention to these strategies.
Right.
You can flatten the curve within 14 days to 3 weeks.
Oh, wow, really?
Yeah. And that's how simple it is.
So that is
However,
if every single person in this country does all the measures that are being asked to be taken.
Yes, it's as simple as that. And then what happens is that you can just isolate and identify those cases that are active, treat them, and stop their spread. But if you don't implement this social isolation and social distancing and all the important measures of cleaning, the local transportation, and all these different things, then you're wasting time because the community is continuing to become infected.
Right.
Because
fair enough.
The tragedy about this particular virus is that people can be asymptomatic but can still be carrying the virus.
Right.
And so governments have to tread this very careful line between educating and advising their community about what are the strategies to be effective and then not instituting panic.
Yeah, for sure. And I think social media is the villain
the
there.
worst thing.
Yeah.
It's the worst thing.
For sure. Just
because
the second part of that question, doctor, sorry, is seasonality of the disease itself. So there are rumors doing the rounds again. I just want to confirm it from an official authority that during the summer, the virus won't be able to survive. So we can actually see a huge reduction in the number of cases. And perhaps as the summer months or as the heat starts reducing, we'll probably see it go up again. Is that true?
So we don't know, do we? Because we're still learning about the virus. So China, we're watching what's happening in China.
Yeah.
Italy, we're watching what's happening in Italy. Korea, we watch what's happening in Korea. So there's a careful observation, as I mentioned, by all these organizations that are the reliable organizations, such as the World Health Organization, the Center for Disease Control, really studying this very carefully. And these are individuals who have spent years studying and understanding how to address, global diseases and public health.
Yeah.
And so it's only through them that you will truly know and learn how to action and the next steps.
For sure. I mean, there are a lot of conspiracy theories doing the round, but again, just asking as a layman, if Bill Gates could predict a virus or an epidemic like this in 2015, do you think we've been more reactionary in taking steps against the virus instead of being more proactive? Although there were people who had already foreseen such a thing to happen.
Yes. So there's lots of conversations happening across the globe as to why is this happening, what could we have been done differently, how could we have prevented this. And so those sort of things are going to be ongoing because, of course, nobody wants to see what we're experiencing.
Yeah.
We want to be always prepared, but this is something that we're experiencing, and I think blame is the worst thing at this point in time. The most important thing is acknowledging where we are and working as community to be able to overcome it, and a global community to be able to prevent it from happening in the future.
For sure. I'm just going to take a few more questions. Sorry.
Sure.
Yeah.
No.
We've just got a few more questions from our viewers right now. So there's Yola Churi, who's asked, are smokers or ex-smokers at greater risk?
So given the fact that this virus and the way it impacts the human body, it's a respiratory virus.
Yeah.
And so anybody who has a long history of smoking or who has a disease related to smoking, like emphysema or something like that, they are at increased risk. They are.
Right.
Yes. They're at increased risk not of contracting the disease, of contracting the virus, but they're increased risk of becoming very unwell as a consequence of the virus.
Which is what I was going to ask. But all of us today, we're all at equal risk of contracting the virus, right?
Yes.
It's just the impact that's going to be vary.
Yes, that's exactly right, Shilpi.
Right. So I'm just going to go to the next question by Shane McGinley. If you have even mild symptoms, can you get a COVID-19 test to put your mind at rest? That rhymed.
That's a really valuable question. And when you are in the state of crisis that the world is in at the present time, where there aren't where our healthcare systems are under stress, just managing the cases as they rise.
Yeah.
What happens is it's really important that we don't overwhelm the healthcare system.
Right.
So we make sure that the healthcare system is able to treat those who need to be treated.
Right.
So if you've got flu-like symptoms, you will not be treated unless your symptoms demonstrate the protocol that the healthcare professionals have for testing.
Okay, so there are a few problems with that as well, right? So if you have flu-like symptoms, and say if you have an influenza B, and we know Tamiflu is the medicine for that, but it has to come through prescription. You can't really go to a drugstore or a life pharmacy and just buy it off the counter, which means you really still have to go to the doctor, right? To just control the symptoms that you have of another flu.
Yes, correct. And there's lots of good reasons for that, Shilpi, in that again, as we as a population are having more and more access to information on the internet or through social media, we know that information isn't always correct. And so we could be advised that we need to have this to treat us. And a common one of that's caused a lot of problems that we face is giving antibiotics for a virus, a flu.
Yeah.
And so that is causing a huge problem in our community with what we call antibiotic resistance or microbial resistance, where the antibiotics are becoming ineffective because we're over-treating.
Right.
So it's really important that you receive advice from reliable resources as to whether or not you should receive a treatment.
Right. So this is just the second part of Shane's question about going to the doctor. So he says that a doctor told me don't go to the hospital to get tested as you run the risk of not having it, but then catching it from someone else at the hospital who does have it. Is that a valid point?
I think that's an important point, and so I think it's one where it goes back to if you have commenced demonstrating symptoms that you feel concerned about, the best thing you can do is increase your social distancing, wear masks, Make sure that those who are living with you are aware of what your symptoms are.
Sure.
If they escalate,
Mm-hmm.
increasingly escalate over the 48 hours,
Mm-hmm.
then you reach out to your healthcare professionals. And increasingly, we're having telehealth being available where you can have a consultation at home,
Right.
where you can talk to a doctor or talk to a nurse via video, and they can advise and talk to you about your symptoms and then recommend whether or not you need to go to hospital.
Right. We have Clinton Poe who had actually asked, and this is the follow-up of exactly what you're saying. So if you don't go to the hospital and you are tested positive of COVID, do home remedies really work? And if they do, what are these home remedies?
So home remedies are an important part of our tradition as a community, and so we need to respect those.
Mm-hmm.
We need to understand that without them being tested, and what we mean by that, going through very rigorous safety studies,
Yeah.
we're not as healthcare professionals able to say whether they're effective or not.
Right.
So it's only through large randomized controlled trials and series of different tests that we're able to determine whether a particular treatment is effective or not. Now, what we might find, and through history, that as a family we've used a particular treatment and it's proven and shown to be anecdotally, and what I mean by anecdotally, as in from our observations that it has benefit,
Yeah.
it's not until it gets into large studies that we're able to prove that it's effective.
All
And
right.
so it's best to go with treatments that we know are effective and reliable.
And of course, Google isn't the doctor. Just coming back to our viewers again, if you do have any questions for Dr. Suzanne here, who has joined to speak about nursing and healthcare in the time of COVID-19, just post them in the comments below. We are getting a lot of questions right now. But before that, just summarizing what we've discussed so far. So today, if a person has a symptom, what should he do? So should he can he just go to a clinic that he goes to, his family clinic? Should he give a call to the doctor, or should he just stay at home and self-isolate? If you can just tell us what to do in one line.
Stay at home, increase your isolation techniques and your safety techniques, which are things like wearing a mask and then, having washing your hands regularly. And then if the symptoms continue to increase and get worse over 48 to 72 hours, you need to reach out to a healthcare professional. And as I mentioned, there are lots of video and teleconferencing options that can support you with that. And then they can guide you as to your next step.
Right, but the treatment isn't being given by all the hospitals here, are they? There are just certain designated hospitals that are authorized to treat COVID.
So the major hospitals, the major public hospitals in the Dubai Health Authority and also the Ministry of Health, they're all prepared and ready to support the community. And so I encourage, and then we also have leading facilities like the Cleveland Clinic in Abu Dhabi and other leading, the American Hospital of Dubai. So there are facilities that are ready and prepared to support the community, but it's so important that the community is active in preventing the spread of the disease, and the social distancing and transparency in symptoms and respect for your community fellows is the critical piece.
For sure. Now, just moving to the healthcare side of this discussion, what are the major challenges that are being faced by the healthcare sector, the doctors, the professionals, and the whole industry today?
So, very good question, Shilpi. And we can see in the news that every health system across the globe is under strain.
Yeah.
It doesn't matter where you are. But it does depend on the government and the community response as to whether the strain is escalated and becomes overwhelming.
Right.
And that's something that you don't want to have. You don't want your health care system to be overwhelmed. And so we discuss things like not testing and not going to a facility, a hospital, unless you've demonstrated over a series of days that something is not right. not just testing to relieve your fears.
Right.
That you're only going to be tested if you demonstrate according to the protocol that you are at risk
Right.
of possibly being affected. And we're very fortunate in the UAE that we have a health authority throughout the various Emirates that are, taking great care in making sure that the healthcare professionals and services have the resources, in particular the protective wear, protective equipment, in order to remain safe, because you don't want the healthcare professionals to become unwell, because if they do, then the healthcare service isn't available for the community. So the government has been really proactive in making sure that they get those resources available to the healthcare centres, and make sure that the community has the education that they need in order to be active participants in this.
But the fact of the matter today is we are understaffed, as is most other countries in the world, because we weren't really expecting this pandemic to happen. So in such a situation, what are the solutions that are being offered for the healthcare sector when there is such a short supply of professionals in the field?
So there is a global shortage of nurses across the world, and so the UAE is active, and they've put a lot of effort into recruiting highly skilled nurses from all over the world and other healthcare professionals who are suitably qualified, and they take great measures to ensure that they're well licensed, and that they're licensed, and that they won't give them a license unless they're highly qualified.
Right.
However, nurses are the largest number of healthcare professionals in any healthcare system.
Sure.
And so you need to take, the government takes a considerable amount of money in providing an infrastructure needed to provide education, to educate and the young Emiratis in order to choose nursing as a valuable and important career choice.
Right. How about testing kits though? So apart from staff, we also need to talk about supply of the equipment. So testing kits has been in conversation for a really long time in terms of the other equipment that is required to sort of combat this issue that we're facing right now. Is that in good supply, or are we struggling with that as well?
So having the ability to test efficiently and effectively is a central measure to stem the virus. And as we've discussed already, there are protocols in place. There are, companies, private companies have come on board, as well as government organisations, to increase the production of test kits.
Yeah.
At this point in time, we're not struggling with having those test kits available to test the patients that we need and we believe meet the protocol to be tested.
Right.
However, if we overwhelm the system, then that becomes an issue. So again, the community being active, not reactive, is really important.
For sure. I'm just going to take a few more questions. We have tons of them coming in. So there's Muhammad Abu Ghosh who's asked, when can we expect the global spread to really slow down? I think we've covered this briefly, but then if you can just tell it for him once again.
So once again, the most important thing is if every community and government around the world was to put in place, seriously put in place, the guidelines, the simple guidelines around social distancing, as in not going out unless you absolutely have to. If you can work from home, if your job gives you the opportunity where you can work from home, you should be working from home.
Yeah.
And that, there's an amazing amount of software options that support disseminated workplaces. And so it's not as if we don't have that software available to us to be able to support that. So if we do all these things, and both the community is active and the government is active, it's shown that you can stem this, you can balance the curve out in a maximum of 3 weeks.
Wow.
It's as simple as that.
So you heard the doctor, if we perform our duties responsibly, it could take between 14 days to 3 weeks to stop the entire virus. I mean, that is a huge responsibility on all of us as individuals right now.
Yes, exactly. And so as we say that, Shilpi, as we speak, it's not being implemented 100%.
Mm-hmm.
Yes?
Yeah.
We know that people are still not applying it 100%. And the problem there is that they could be infected or become infected. And so they're just continuing to spread the disease and
Yeah.
keep it going.
Yes.
Spread the virus. I keep using the word disease.
The virus, for sure. I'm just going to take a few more questions now. So people are spending crazy amounts of money on buying vitamin C and antioxidants. Is it recommended? Will that help at all?
So again, as a healthcare professional, I'm not able to recommend a treatment
Yeah.
that hasn't proven to be effective
Right.
and proven to be effective in large randomized controlled trials. However, people take such supplements to optimize their health and well-being, and they've shown in studies to be effective in improving our resistance and particularly the vitamin C and different things. And so, these supplements are for different people are valuable. But as a healthcare professional, I can't suggest that that's what you need to be doing.
Right. Sure. Just going on to Saif Al-Mamri's question. Can mosquitoes and flies transmit COVID-19 to humans?
So a very good question, because we know that with similar diseases that we face, such as malaria,
Yeah.
that is transmitted through such vectors, what we call vectors. There has been no evidence at this point in time to suggest that COVID is transmitted. What we know about COVID-19 is it's a respiratory virus that's disseminated through coughing and sneezing and transmission on the hands and other things like that.
Right, so far this session has proven to be a little bit of a myth-busting session. So let me just ask you this question as well. A lot of confusion around it. Is COVID-19 airborne or not?
So we are still learning about that. And what we use, the term we use, is it an aerosol? Like, for example, does it suspend and sit in the air can it stay in a room even when somebody who has it leaves? So that's the question. That's what we mean by, is it airborne?
Right.
Now, we don't know for sure about that. That is still something that we're learning about. So I can't give confirmed evidence or evidence to support that that's the case.
Right, sorry. So when you said aerosol, do you mean suppose there's a person in the lift and he has COVID-19 and he coughed inside the lift and then he left the lift. So are you talking about that? The particles can still be in the air because it doesn't just dissolve.
Exactly, Shilpi. And we don't know that. We don't know for a fact if that's the case. However, in healthcare centres where they're treating patients who are affected by, they've tested positive for COVID-19, they take all precautions. Because we don't know, they take all precautions in case we learn that is a form of transmission. So there's no evidence at this point in time to suggest that that's the case.
Right.
However, we protect our healthcare professionals, such as respiratory therapists, such as anaesthetists, and nurses and physicians, who are doing aerosol type of treatments, where they're intubating or they're doing some form of respiratory treatment. They will be protecting themselves to minimise that.
Right, and just because you mentioned this, the hospitals and the doctors, nurses, all the staff in the hospitals, they are well equipped with hazmat suits and masks and everything right now, right?
Correct.
Great. Moving on to a few more questions, and of course, I need to remind our viewers again that if you do have any questions, post them in the comments below. Dr. Suzanne is taking all the questions from the ABTV viewers today related to nursing and healthcare in the time of COVID. The next question I will be taking is from Anushka Rao. If someone shows one symptom of COVID-19, should they reach out to their local doctor or should they wait for all the symptoms to show?
A good question. So this is, there are a set of symptoms a cluster, what we call a cluster of symptoms that
Right.
meet the protocol to being tested.
Right.
And at the moment, that is a dry cough or a cough, a sustained cough, and a high fever, a very high fever.
Okay.
And so if you have these symptoms and muscle aches and all those sort of things,
Right.
and it's been sustained, and the other really important one, but that's diminishing, is if you've been in contact or you've travelled in the last, week or so to one of the countries where there has been an outbreak. So if
Right.
you've got a cluster of symptoms or a cluster of predispositions, then if over 48 hours they become worse,
Yeah.
then that's when you get tested and determine whether it is actually you are positive.
Right, doctor, I need to ask you this though. Is there a chance of infection? As in, can one person who's been infected by COVID get the infection back again?
So that's something that they're learning.
Okay.
They're still learning, and at the moment they believe that there is a level of immunity that develops because of the antibodies
Yeah.
that kick into place when a person has been infected. But again, we can't be sure because we're learning. We're still learning whether that's the case.
But so far, there haven't been a case where one person who got COVID first got it again.
Not that we're aware of.
Right. Moving on to the question from Rashmi. How can educators train the future generation of healthcare workers to be better equipped to deal with issues such as these?
It's a very good question, and that's a question that's foremost in our mind. Public health is a critical element that's important in helping communities both prevent and also manage events such as this.
Yeah.
The important question is, and it also points to the importance of healthcare professionals full stop, that a community's well-being is dependent on a robust healthcare workforce.
Right.
And that this event across the globe is making that incredibly obvious. So we often exist in a world where that just is happening in the background until something happens to us.
Right.
But when it becomes so obvious and so it's touching everybody's lives, all of a sudden healthcare professionals are seen as 100% essential. And if we don't have it, the well-being of our community suffers, and so does the economy.
Right. So
And
then,
so,
is there a demand-supply gap then in terms of what is being offered by the universities in the UAE and in Dubai today to what is really required on field in the job market?
no. So I would argue that, unfortunately, what we're seeing is that the young people aren't choosing healthcare as a profession.
Okay.
And so that despite universities having their programs available to educate and support people to become licensed healthcare professionals, whether that's a nurse or a doctor,
Yeah.
the people aren't choosing healthcare as a career choice. And the government is spending a lot of money because, as I mentioned, that if a country doesn't have a well-structured and robust healthcare workforce, then the country is at risk, the community is at risk.
For sure.
And so you're dependent on an expatriate workforce, or you're dependent on always trying to manage the growing healthcare needs and then address crises when they happen. And so identifying, the UAE government has a whole campaign in place at the moment where they're giving scholarships, they're supporting, they're acknowledging the income, the guaranteed income that young Emiratis can have when they graduate from nursing, if they choose nursing as a career. And nursing is a phenomenal, of course I'm biased, but phenomenal career.
Right.
The variety and opportunity that is there for you to change specializations, that if you don't have to worry about, oh my God, am I going to be stuck in a career that I'm going to hate for the rest of my life? You could start off doing midwifery and then choose to go into clinical informatics. or
Right.
choose to go into quality or choose to go into research. So much variety.
So this is
And you
basically
can
one
travel the
profession that's
world.
never going to die. You know,
Never
whatever
going to.
happens in terms of
Never.
automation, AI taking over the world, healthcare is
Yes.
still going to be in demand. Just again,
Yes.
moving on to some of the questions that are coming in. We have Davina. Davina asks, the UAE is introducing drive-through testing centers with test results available in 5 minutes. How accurate are these test results, and at what point should one consider going to a drive-through center rather than a proper hospital?
I'm not understanding the question. A drive-through. So a drive-through centre. Is that what she's asking?
Right. So the UAE
Okay.
recently had introduced a few drive-through centers where swab tests are
Yes.
essentially being done. Yeah.
Yes. So that's the initiative that was very effective in Korea, and it helped Korea reduce and flatten the curve very effectively. And so the government is implementing, and that's what I mentioned about the government being so proactive,
Mm-hmm.
that we are so fortunate as a community here that the government has been so proactive
Yeah.
in introducing all the recommendations from the global health authorities as to how to stem this virus, the spread of the virus. And so they're testing lots of different strategies with the drive-through as an example,
Right.
because as one of your listeners pointed out, hospitals are becoming the place where patients who are infected are being treated.
Right.
So if you can reduce the number of people going to a hospital, then you reduce the risk of them also being infected. And so drive-through centres can be a valuable way to do that
Right. So
as
this is
one
basically
strategy.
something that we've learned from another country,
We
but
have,
one of the countries that has set a very good example in terms of battling this entire crisis is, of course, China and what's happened with Wuhan. Like,
yes,
they've almost gotten rid of the entire crisis itself. So we've seen in a lot of the Asian countries where doctors from the Wuhan hospital are sort of going to different Asian countries, giving their expertise on what they did. Are we in Dubai
wonderful.
and in the UAE also doing something similar to that, where we're taking the resources that they have to offer and the expertise that they have to offer with doctors
Ev-
from Wuhan coming in here?
yes, every leading health authority around the world is taking advantage of this information. And the individuals don't actually have to be in country to provide that. As we shared, we have video conferencing capacities and abilities available to us. And so health authorities here and also around the world are tapping into this knowledge source continuously.
Right. Great. Another myth or another argument that we've heard a lot in the recent past is that if you're young and healthy, you're not going to contract the virus, and if you contract the virus, you're going to survive. I know we've discussed that they can still be carriers and they can still transmit it to the people who are more vulnerable. But is the first part of it true at all? That if you're young and healthy, you're not going to be affected by the virus?
The evidence to date shows us that that's false.
Okay. So if you are young and healthy and fit, you can still catch the virus and be drastically affected by it.
Correct, Shilpi.
Great.
There
How?
have been deaths of young people, young healthy people.
Mhm.
So this is a myth that needs to be dispelled very quickly.
All right, you heard the doctor again. Another myth has been busted on the show today. Uh, so, how effective are the masks? I know a lot of people around, whoever's stepping out today, they're wearing masks and gloves and all of that. But would you say it is effective even if you're not showing symptoms?
So Shilpi, there is a variety of masks that are available, and depending on the quality of the mask will really influence its effectiveness. And so um, determining the mask is very much about limiting the spread, as in if an individual is coughing
Mm-hmm.
or sneezing, then it can reduce the spread. Does it limit the person who is not symptomatic contracting? Will really depend on the quality of the mask that they're wearing. And we're still learning about that as well. So we've got what's called fit test masks
Okay.
and a whole different range of masks.
Mm-hmm.
But across the globe, the availability of these high quality masks are under strain
Yeah.
because they need to go to the hospitals
Right.
where the people who are at highest risk need to be able to use them on a daily basis.
Sure.
And so the WHO have multiple examples on their website about the different types of masks that you can use and how to use them. And so I encourage people to go there and have a look at the information that's available there.
All right, great. So, but then you're still saying that if you're not really showing symptoms, we probably should stay away from masks and let the healthcare professionals and the hospitals have it, yeah?
Yes, correct.
Just
Correct.
taking in a few more questions, we have Trish who's asked, this crisis has reiterated the role of people and not just technology in combating crises like this. What's your take on the need of healthcare professionals globally, especially professions such as nursing?
That question broke up. I'm sorry, Shilpa. Can you say it again?
Sure, I'll
Sorry.
just read that out one more time. This crisis has reiterated the role of people and not technology in combating crises like this. So what's your take on the need of healthcare professionals globally? And second, especially professions such as nursing?
So a very important question, as we discussed a moment ago,
Yeah.
that a community's health, both its well-being and its economy, is dependent on a robust healthcare workforce. We need to ensure that we are educating and providing the education
Right.
that young Emiratis and communities around the world need in order to go into healthcare, choose health as a profession. Nursing, being the primary healthcare professional in any healthcare system, is of critical importance. And so optimizing the opportunities for young Emiratis to learn about the profession, understand what's involved, rather than taking on false notions about what it is in the
Yeah.
profession. Actually learning. If you're a young person, or even a middle age, and you want a career change, you can go and do nursing. Lots of programs across the world. We're seeing a lot of career change people go into nursing as a second career choice, because they realize and they recognize that healthcare has real purpose.
Yeah.
If you're in a profession where you're wondering about what's the purpose of what I'm doing, you turn your eye and you turn your gaze, and at times like this, you realize that a profession like nursing has genuine purpose.
For sure.
You're helping to keep the community well.
For sure,
And
yeah.
so
Social
that's such a
enterprise, again,
rewarding.
another thing that is becoming very, very prominent in this region, where people want to make a social impact and start businesses on that level. So it is exactly on the lines of what you are saying right now. So basically, we
Yeah.
need more healthcare professionals, and we've seen it in a crisis like this. And this is not the first time something like this is happening. We've seen SARS, we've seen MERS. So many of these epidemics have happened, and it's if it's not a cycle, it is something that is bound to happen in the future.
Again, many people are saying that this is just a prelude, that this is just a short commercial before something else happens. So we need to learn. And as you pointed out, Shilpi, that healthcare professionals, particularly nursing, are the one profession that is not going to be removed by artificial intelligence and technology.
Right.
People want to be cared for by a human being. They want a person who can share and support them and guide them through the experiences that they have when they're unwell.
Right.
And so they don't want an artificial intelligence doing that. And that they want the specialized knowledge that nurses and other healthcare professionals provide them.
Right. So you did mention that this is a trailer for something that could be worse. I mean, is that something that is being predicted by the CDC, WHO, etc.? Are we expecting something more, something worse?
Well, I think as we discussed earlier, Shilpi, there were lots of predictions and assumptions that this is something that we need and governments across the world need to be preparing for. And so those who are learned in understanding how these global pandemics occur,
Yeah.
public health, what we call the public health detectives.
But is there a pattern
They,
to it though?
beg your pardon?
Is there a
Is there a pattern?
pattern? Yeah.
So there is a suggested pattern that as these viruses become more complex, then they readily mutate. So we just need to be prepared. We don't know for sure, but that shouldn't prevent us from preparing.
Right. Just going to take a few more questions. I think everyone's really
Sure.
surprised and not at ease right now as we hear these staggering facts from you. But moving on, Anushka Rao, she's got another question, which is it true that babies have not been affected? I have a 10-month-old and a 4-year-old, hence I'm asking the question.
I think it's really important, Shilpi, to not segregate any member of the community
Right.
from the preventative measures that are being recommended,
Right.
because there's a belief that they're not going to be negatively impacted. Because, as we've discussed throughout this whole discussion, we're learning. We're running as fast as we can, and we're learning about this virus as we go along. And so it would be dreadful to look back and, a couple of weeks' time and say, oh, my God, we were wrong about children and babies. So
Right.
even though we are not seeing the number of cases for young children, and there are a number of different assumptions arising as to why that could be the case,
Yeah.
we should not remove them from the practices that were being recommended to minimise the spread.
Right. I have another industry-related question, which is in this region, in Dubai and UAE, the wider GCC, have we seen that the involvement of private sector has been limited or restricted for some reason? Is that something that's happening on purpose?
I think, is this in relation to COVID and the management of COVID? Is that
Correct.
what the question? Okay.
Yes.
So I believe that in any country, the first step is at a federal level or at a government level to try and assess the situation. The second step or second stage is then to engage industry, local industry, in order to try and to manage the event. And so it comes in waves and cycles. And so the example of the test kits and the vaccines is a perfect example,
Right.
where first you go to the government and the government agencies to try and address this, and then if they're seen not to be able to match it completely or fully, then companies and private companies are brought on board to try and support and address the issue.
Right. I think the session was supposed to be 30 minutes, but we've almost gone to 60 minutes. Unfortunately, we'll have to wrap up the session soon. But I'll just address one more question that we have from Swaroop. So apparently, it says that COVID isn't airborne, that the virus can withstand on air almost for 3 hours. If that's so, it can be airborne, right?
We don't know for sure.
Yeah.
As I mentioned, at the moment, the understanding is that it's droplet transmitted, as in it's through a sneeze or on your hands, and then you shake someone's hands or you put it on a doorknob or something like that.
Right.
If it is aerosol, we don't know for sure. We're still, the evidence to prove that is we don't have it, and we're still learning. And so, but the preventative measures are in place because it's a respiratory virus, and we know that for sure. The healthcare professionals who are doing respiratory procedures and techniques are optimizing their prevention, that it could be aerosol. But at this point in time, we don't know for sure.
Understood. Another question that we have, I think it is from someone who has been tested positive for COVID, is if a person is tested positive for COVID and he has recovered, he's gone through the treatment, etc., when would be the right time for him to go out and meet people?
So his healthcare team would have advised him as to what he needs to do.
Yeah.
The most important thing is that he has a retest and he's tested as negative.
Okay.
So that's the most important thing.
Right.
As we've learned, again, we're learning. about this virus.
Sure.
We're learning about whether it remains dormant or what it does. We don't know. And so whilst a person can recover, we don't know whether they're still infected. So we're in the process. And so I would encourage that the individual maintain optimum measures that they've been advised until such time as they've been tested as negative. And then they've been given the advice by their healthcare team that they can now connect with their families.
Great. Thanks so much for your time, Dr. Suzanne. But just leaving you with this one final question. I think this is one question that all my viewers want answered. You've said that we can't believe social media, we need to stay away from fake news, etc. At this point, what would you say are the right sources for information? If there are certain websites that you can let us know, or certain people who we can talk to either on Zoom or web calls, etc., are there some recommendations that you can give to me and our viewers today?
Absolutely critical importance. There's nothing more important than ensuring that you actually have the right information, and that supports the community to be active rather than reactive. Stay away from your social media because it just will make you so anxious, and it'll give you false information.
Right.
So I will share with you, Shilpi, the 3 websites that I refer to on a daily and regular basis that we know our government, the UAE governments and governments around the world rely on in order to both report their data as well as receive guidance. Okay?
Right.
So I'll provide those for you.
Great.
And you could post them, have post notes.
Perfect. So I'm going to be posting the website that Dr. Suzanne is going to give me in the comments over here, and we'll be doing a different session for the right sources of information on YouTube. So you can head to Arabian Business's YouTube channel for this. Thanks so much, Dr. Suzanne, for joining us. Thanks so much for busting all of those myths and giving us so many of those valuable insights. We've learned a lot today.
It's a pleasure.
Thank you
for the opportunity.
And thanks to the viewers for joining in.
And stay safe and healthy. That's the most important thing. It's simple.
You too, ma'am. You too.
It's not hard.
Exactly. Social distancing is the name of the game right now. So stay safe, all of y'all. Maintain the distances. Don't get out. Stay home, work from home, do all of those things. And we will continue bringing to you news and further updates from here on ABTV. So don't forget to subscribe to our YouTube channel, follow us on Facebook, go to ArabianBusiness.com, and thank you. We will be back again next Tuesday.